Fox.
I believe that we will have the votes to pass this in Congress. I believe that the president will keep fighting and that the American people want to have this kind of health reform.
But you don't have the votes yet.
Well, look, the president will have more to say about that later this week, and he's working with the Congress on how best to address that.
Well, Democrats want to move forward with the health care overhaul. 3 days after the bipartisan health care summit, Republicans say they're glad they had a chance to air their ideas, but they continue to call the president's approach too complicated and costly. Local Congressman Bilbray is here to discuss what's next. I want to say good morning, first of all.
Good morning, Attell.
Good morning, and I want to start with, I asked Francine Busby the same question. And Woodard, tell me, in your opinion, 3 items that need to be included in this bill to make it move forward.
Well, you need accessibility, you need affordability, and I think that one of the things you got to talk about is just about making the system work for the recipient. I think one of the biggest things that I'm frustrated with, as somebody who spent 10 years here in San Diego providing the healthcare network for San Diegans, a population bigger than 20 states, was that how do you talk about affordability without doing tort reform on the top? I just know that from my experience here. And frankly, there's ways we can do this. I think what happened last week, a lot of people...
Like, for instance, what can we do?
Well, first thing we did is last week we were able to eliminate the antitrust exemption for the insurance companies. We need to do that. But on the same time, we got to eliminate the freebie for the lawyers and start having tort reform to limit the damages. You not only had that...
So why can't that be included?
Oh, it absolutely should be, except you got to understand, you've got both sides playing to their side and not willing to pitch in. I think last week the Republicans pitched in the insurance companies, but the Democrats don't need the Republicans, so they won't pitch in the attorneys. The attorneys are a major political force.
Congressman, and you know how much I love you because your wife's from Louisiana.
Yeah.
But right now my eyes are just glazed over because I'm tired of it. And right now I'm speaking to you, looking in your eye and telling you that the people are sick of it. We're sick of it. So please do me a favor and be clear with me and tell me specifically that people can understand what can we do to move this thing forward. You have a lot of people out there who are hurting.
What you can do is require the Republicans to put the insurance companies on the chopping block, require the Democrats to put the trial lawyers on the chopping block, tell both sides, look, we don't care where you get your campaign money, we want to see a result. And that means your buddies, no matter which side it is, have to contribute to the answer and make health care more affordable. That's what we got to do.
Is that going to happen?
What's going to happen is the fact that no, because in Washington right now, one side basically says we don't need the other side at all. When you have over 40 votes that you can lose in the House of Representatives, this is not a battle between Republicans and Democrats.
Guess what? You guys are going to lose those votes anyway. You know why? You're going to lose at the polls because people are sick of it, Congressman. People are really fed up and tired of all the politics and the business as usual. And so, again, you know, what can we do? You guys are there working for us. What can we do to get this thing moving forward? And I still am not hearing
I think what we can do is what we did last week. What can we agree on? We agreed that antitrust laws should be changed. Don't hold them exempt. You've got to do these things you can do. But you got to remember, Ethel, this is not a debate, again, between two parties. Within the Democratic Party, they have.
I understand.
They have all
the
votes. They know what you're doing.
I knew you were going to say that.
Well, and I was just saying, but the problem is this: is that you need both sides sitting down and working together from the get-go, not at the last minute.
And you guys have been working together from the get-go, and you guys have been saying no a lot from the get-go.
You weren't even allowed in the room when the negotiations went on.
So none of the items from the Republican side are in the bill that's on the table now.
There was no Republicans in the room when Henry Waxman was cutting the deals with all the special interest groups.
Okay, so you guys are in the room now, and so that's why you want to start from scratch. Does that mean you really want to start from scratch, or do you want to kill it, sir?
The fact is that we know we can do it. We want to be able to correct this because cost containment. It can be done.
Then do this. We want you to work and make this work. Then do this. Take whatever it is that you want included, put it in terms that everybody can understand, everybody can agree on, and present it. That's what the president's asking.
It was presented. Here's the question is, will you allow both sides to sit down and come in and say, where can we agree on, and let's start there. We did it last week.
Then why'd y'all do that last week?
We did it last week, and it worked out. Now, why don't we also say, let's look at the other aspects of it. Let's go ahead and eliminate the monopolies that are created for insurance companies in states. Let's do cross-state.
So you want to do your
let's do a cross-state deal.
Okay.
When you do that, if you throw in tort reform, the minimum $54 billion, how do you walk away from that kind of savings?
So cross-state, which would allow people to go, if I don't like the insurance offered here in California, I can go to Utah and get my insurance.
You break up the monopolies. You allow portability, you allow people. I'll tell you a big one. Give the same tax benefit to individuals who take their money and buy insurance as you do to somebody who has their employer or their union give them. That's something that Washington should have done long ago.
Do you believe, Congressman, that the millions of Americans who are without health care should be covered, that there should be some sort of reform, that they can be included?
Yeah, I think the best way to make them is first lower the cost of providing health care. You can't promise people more coverage when you can't pay for what you have now until you go do the tough things
and
tell your buddies that they're all going to have to contribute and lower the cost.
And you lower the cost simply by?
You lower the cost by allowing portability. You lower the cost by allowing cross-state. We just eliminated the protection under the antitrust, so you break up the monopolies, but you've got to bring the trial lawyers and do something about tort reform. Everybody says that we can do that.
So get her done.
Well, as long as what's happening is you're going to see that they're basically said, look, we have 40 votes, we have so many votes, we really don't need to talk to one side, we just need to get our own side together. And I think you're going to see this week they're trying to get their side together. The fact is, the majority, elections matter. And what that meant was, we don't need to talk to the other side. We have so many people on our side that all we have to do is get our act together. And right now, you're seeing the Democrats are trying to get their act together and get enough of them to vote. What was missing at this retreat was the moderate Democrats who voted no, the 39. They should have been the ones.
So the cards were stacked against you, as you're saying at the meeting.
Well, no, it wasn't stacked. I thought it was a great meeting.
I thought it was great, too, actually. All right, we have to go. It's frustrating.
Look. Miracles can happen. The Saints won the Super Bowl. Anything can happen.
All right. Congressman,